Arthritis is a very painful condition, and when it affects the knee, it can seriously impair mobility. There are new treatments and therapies that are helping to alleviate the pain. Dr. David Duffner of Desert Regional Medical Center in Palm Springs tells us about knee arthritis and the range of treatments.
Most patients that need joint replacement have osteoarthritis, over 90%. A few patients have rheumatoid arthritis and some have post-traumatic degenerative arthritis. But the vast majority have the usual type of what we call wear and tear osteoarthritis. The diagnosis is very straightforward. The patients have pain and impairment in activities of daily living because of lack of mobility. The diagnosis is made by history, physical examination, and an x-ray. And so it's usually very straightforward. We always try non-operative treatment first, and that can be physical measures such as using a cane or a shoe with a certain type of insert, that type of thing. Medication, just plain Tylenol sometimes is a good place to start. Beyond that, anti-inflammatory drugs are the next step. In some cases we use narcotic medication, but that's really not a good strategy for long-term management. That's more for short-term pain management. Beyond that, the options are injection, and there are several different types of material that we can inject. One is an artificial joint fluid. We actually take the old fluid out and put in new fluid, which is a natural product. It's not a drug, and it's kind of like having an oil change in your car. You pull out all the bad stuff and put in some new slick stuff, and the joint can work better. That's not a cure, though, but it can buy some time. And we usually recommend that people go as long as they can on what they've got on their natural equipment until they get to the point where they really just can't function in their normal activities of daily living. And at that point, then joint replacement is a reasonable alternative. This is a model of a knee replacement. This is the femur or the thigh bone. This is the tibia or the shin bone. And right here is the kneecap or patella. And this is the way the knee works when it flexes and extends. You can see that there are three parts of this joint replacement. There's the resurfacing of the end of the thigh bone. There's the plastic on metal resurfacing of the top of the shin bone. And then there's a little plastic part that covers the back of the kneecap where it articulates with the distal femur. The exciting new material is this component here, and this metal, it looks like kind of a black pearl finish. This is oxidized zirconium. Zirconium is a certain type of metal that is very closely related to titanium. Titanium and zirconium have a tremendous advantage in the body because the body does not react to it at all. So it's very biocompatible. The other big advantage to oxidized zirconium is that it's smoother and harder than any other material that we have had in the past to do knee replacements. This operation is extremely successful. Total hip and total knee replacement surgery success rate is over 95%. We have about a 1% complication rate, and most of the time complications can be managed, so if there is a complication, it doesn't mean necessarily that it will turn out to be a bad result. But the patient satisfaction is very high, and basically what a person gains is they gain their mobility and the ability to participate in normal activities of daily living, and that's worth a lot.